Good evening to all the viewers who are watching live and will be watching on the recorded version. It's me, Orku Mukherjee, Dr. Orku Mukherjee with you guys. So again, a sad report that we are yet to just get back to that auto regeneration certificate thing startup. So please be cooperative and we will start as soon as possible and we will let you know on community tab or join our WhatsApp channel to get update over there too. And again, one more thing, uh, before starting the show, I hope you will enjoy today's CMA as it's a great topic for me. So without wasting any more time, let's just jump into 30 seconds countdown time.
Good evening. Good evening, Dr. Mukherjee, and all of you who are on the screen and out of screen. Probably Bidyut has become muted.
Dr. Mukherjee, please remove your headset.
Hello.
Doctor,
Now be audible.
here now
Hello.
we can hear you.
Can you hear us?
Yes, yes.
Okay, sir. Slowly but steadily, we had been moving up to the 125th CME, and today we are on the 120th episode. We are lucky to have tonight a person who had been the speaker of the first ever online CME. Tonight, in our 120th episode as a moderator. But before that, with the permission of our beloved President, Dr. Devnaran Kalyani, sir, sir, with your permission, I'm calling on tonight's inaugurator, Dr. Sumana Sengupta.
Sure. Please go on. Sumana, please.
Over to you, Dr. Sumana Sengupta.
Good evening, all viewers. Am I audible, sir?
Sure. Yes, Sumana,
Okay.
you are audible.
Okay. Thank you, both of you, sir, for inviting me. I am the undergraduate and postgraduate from NIH. So, being the ex-NIHian, it is my privilege to inaugurate 120th online CME in this platform. So, it is our really proud moment for us to observe online CME conducting successfully. And special thanks to both of you, sir, and entire team. Today we have with us Professor Dr. Mohan Giri, sir, as speaker. Sir is third batch UG and PG scholar from NIH and ex-research fellow of NIH. Currently, sir is professor and head of the department, Practice of Medicine Department, DND Homeopathy Hospital, Kolkata. Having extensive academic knowledge and clinical acumen, sir will deliver his speech on the topic Fundamental of Hypertension in the Light of Homeopathy. This session will be moderated by none other than Professor Dr. Rajat Chattopadhyay, sir, Principal Administrator, the Calcutta Homeopathy Medical College and Hospital, oldest homeopathy college in Kolkata and all over the India. Being brilliant academician and expert administrator, sir is well-known figure in homeopathy fraternity in the India and across the globe, who actually doesn't need any introduction. So I request sir to input his valuable speech in this session. Over to you, sir.
Sumana. Dr. Sumana, thank you for your inaugural speech. Today's speaker is Professor Dr. Mohan Giri. He is the head of the Department of Practice of Medicine of DND Homeopathic Medical College. And also, he was previously attached at Maheshwar Homeopathic Medical College as assistant professor and then assistant professor. And I was fortunate enough that Dr. Giri, during our service, Dr. Giri was with us. His profound knowledge in clinical medicine and update knowledge with the background of research background, being a student of NIH at UG, PG, and also in the research level. So it's a vast arena with huge experience. I think Dr. Mohan Giri today will enrich all the participants here through this webinar. And first of all, I must convey my thanks to this National Institute of Homeopathy Alumni Association, because the one alumni association, a tremendous responsibility, one alumni association for like institute like esteemed institute like NIH. It has, and that is the carrying the legacy of NIH through this alumni association, all the CMEs, all the academic programs, and since long it has been continuing as a very good spirit. It is to be learned by the young professionals from this team of Dr. Bidyut Mukherjee and all others, even very senior Dr. One another very senior alumni, like very many, so many. So I will not take much time, but it is to say that the essential hypertension in the clinical medicine, in the cardiology part, hypertension is one of the most important part. And if I am not wrong, what is my knowledge is concerned, that hypertension, diabetes mellitus, and the ischemic heart disease with hypothyroidism, these are the four domains on which government of India as well as our whole Indian doctors, they have been working hard from the policy making part, from the future implications. So it is the right time to discuss detail about the hypertension. And there are so many changes in the clinical medicine. You know, all that clinical medicine is very dynamic subject. So what was the range during our students' tenure? The range of systolic hypertension and diastolic hypertension and very many treatments of hypertension, the cause, etiology, complications, everything has been changed profoundly. Maybe the very basic things remain same, but the etiopathogenesis, from the etiopathogenesis to the classification to the diet management, everything profound changed. And being a man of medicine, we have to remain updated. But as a man of profession, homeopath doctors, each and every homeopathic physician, they have to also remain updated with these changes. So NIH Alumni Association is taking a very important role in making the update of all those physicians, especially related to National Institute of Homeopathy and others. I know that not only in India, abroad also we have these NIH alumnus, and they are also very knowledgeable persons. But with these type of seminars, we get time within our all are busy within the busy schedule, just to think again, just to open the pages again, just to remain update. Or the if the work of this association can ignite us, that our again interest to open the latest clinical medicines pages, and especially today's topic, hypertension. I know that Dr. Mohan Giri will enrich us. So let go to Dr. I will hand it over my mic to Dr. Mohan Giri. Please, then again we will meet after his lecture. If any question you have, you may put it there. Then after his session, Dr. Giri or myself or any other interested senior persons here, we can give reply. Now, please hand it over to Dr. Mohan Giri, Professor Dr. Mohan Giri. Please.
Good evening to one and all the alumni of this prestigious institute, National Institute of Homeopathy. I'm audible, Bidyut?
Yes, sir, you are audible, sir.
Yeah, and my respected Dr. Kalyani sir, this is the great honor to have Dr. Kalyani sir over here. And being the student of this institute, I can recall my memory of the first class of Materia Medica of Sir Arsenic Iode, and you are still using this drug with very successfully and always remembering sir's tips and teaching regarding this. And my respect to Dr. Rajat Chattopadhyay, you can say Dada, and as Dr. Chattopadhyay has told, you have worked at the same time in the Mahesh Bhattacharya, and I was fortunate to work with him. Very dynamic person, always inspiring and always ambitious, always thinking regarding the progress of our system, clinical medicine, along with the clinical knowledge and clinical orientation development in homeopathic. So great to have Dr. Chattopadhyay as a moderator in this session. My respect to my very sensible colleague, Dr. Sumana Sengupta. Really, she's you all are medicine faculty in DND are NIHian and very good team, and she is one of the most sensible colleague I have. I can consider myself lucky along with Dr. Beena Prasad Bharti. She is also working with us. All three are from NIH. My respect to Dr. Pralay Sharma. He is director in charge. This is the proud moment from the first batch. And you can say Pralayda. And this is the, and my respect to ex-director of NIH डॉक्टर सुभाष सिंह सर, वो हमेशा हर समय हर स्टेज पर हमें इंस्पायर करते रहते हैं. जहाँ कहीं भी कुछ भी अगर इस क्लिनिकल फील्ड में ज़रूरत है, हमेशा बोलते हैं मोहन ठीक से शांत से आगे बढ़ो. एंड माई रिस्पेक्ट टू ऑल माई टीचर्स, senior teachers. You have just, there was Guru Purnima 2 days before. I am lucky enough to be a speaker today. My pranam to my all respected teachers, directly or indirectly, who has taught me at the whole student career, or I can say in beginning of my career all over in NIH. My special thanks to a respect to Dr. Ashok Kumar Das sir. Under his expert guidance, I have started my career in research from the NIH. So this was great to be first employee in the field of homeopathic research in NIH. Another thing, and my sensible respect to Dr. Bidyut Mukherjee, to carry on this Alumni Association and Alumni CME. This is the great achievement I can say, and this is the one of the biggest, largest alumni association in this field of homeopathy. And this moment, you can realize how Bidyut has dealing along with our sir Kalyani sir and other Pralayda sir. But today, you are directly or indirectly attached with NCH. NCH also promoting this, giving the emphasis over developing the alumni association in institute, in all institute, because due to some certain limitation, the official person is having certain lacuna. Along with certain person is there who are practicing, renounced practicing in this field of homeopathy. So there is need of interrelated correlation between this practitioner and this institutional person. And you are lucky enough in DND homeopathic, under the guidance, under the sensible guidance of Dr. Subhasis Ganguly, you have done certain workshop and seminar regarding this development between this practitioner and institutional personnel overall to developing the clinical eye in the field of homeopathic along with this clinical knowledge. Another thing, I am coming to the topic. Slide. Just a minute. Click. इसको कर देना. So, fundamentals of hypertension. Actually, this is not a teaching, and you all are the doctors, whoever attach over here in the CME program, my respected teachers, students, senior, junior. This is the actually one of the, you can say this is the awareness program, as our moderator Dr. Chattopadhyay has told. The basic thing is the hypertension and clinical knowledge of hypertension is nothing changed. But there is modernization, there is need of clinical modernization and correlation between our homeopathic system. So hypertension is, this is not like that, this is the teaching, only this is the fundamental concept. And hypertension, you can say this is the arterial blood pressure. And as our moderator, sir, you have worked with and he is very much expert regarding this cardiovascular system. And I used to teach this neurology, but I can say this is the link between the cardiovascular system and neurological disorder. This is the hypertension. And hypertension nowadays become the social problem, or you can say this is the endemic disease all over the world. And this hypertension is responsible for all the basically coronary heart disease, even stroke, one of the dangerous disease, and other lifestyle disorder with either directly or indirectly associated with hypertension. So this is the one of the link between cardiovascular system and neurological disorder. This hypertension is actually known as silent killer, because even there is no sign of symptom, but person is having high blood pressure. And in our institutional teaching or in clinical practice, there is need to develop the skill or routine examination of blood pressure, because sometime person is coming with a very high blood pressure and they are not conscious regarding this, they are having blood pressure. And in community medicine, this disease is known as the iceberg phenomena disease, because this remains silent, but any unavoidable circumstances, this may lead to serious complication, or they may lead to even death of the patient. So as for WHO guideline, this is the definition of the hypertension. There two words should be very consciously considered: persistent rise of basal blood pressure. If the person is having persistently rise of blood pressure, that can be considered as a hypertensive or basal. Basal is the concerns word that their blood pressure should be recorded after certain amount of physical and mental rest. Sometime person is coming and forcing the doctors, senior doctor or junior doctor, to please record my blood pressure, or forcing, but mind that our duty to actually give him some certain amount of mental or physical, at least physical rest. This is the very easy to say mental rest, but this physical rest is always required to consider the hypertension, because otherwise if the pressure is fluctuating, on that time you have to consider the certain other concern regarding this epidemic prevalence. Just I have told, this is the endemic disease all over the world, and this is the second commonest cause of premature death worldwide. This is the sensitive indicator. That's why who has given guideline, even World Hypertensive Day is 7th May, and they are giving the provision to aware the community health issue, and community doctors or community health workers, that there should be one routine examination of the blood pressure and pulse that should be routinely done by our physician. So you can say this is the prevalence all over the world. After accident, hypertension is the one of the disease where from that person is dying prematurely. Premature death is occurring due to the hypertension or sudden rise of temperature. This is the predominance. Male is having high predominancy than the female, and there is etiology behind that. Most probable etiology, there may be the cause of certain lifestyle, or the male are, you can say there is much more smoker than female. Nowadays this is the few old data, but data is gradually changing, as our moderator has told. Modernization and gradually changing the data of this male female ratio also. So this is the consideration of blood pressure. Normal blood pressure, that should be under systolic blood pressure under the 140 mm of Hg, and diastolic under 90. If the pressure is more than, there is grade 1, grade 2, grade 3. If the blood pressure is more than 180, that is always dangerous. Or if the diastolic is more than 110, this is also dangerous. So our motto to reduce this level of blood pressure within this. But one question is coming, what sort of danger coming if the pressure will increase, and how much reading is, which reading is much dangerous for the, and how this is the dangerous. So as our moderators had told, cardio, this is the relation between cardiology and neurology, because systematic blood pressure is always our cerebral blood flow. The blood is circulating from heart directly going to the brain. There is no any separate channel to control the cerebral blood flow. And this blood flow is controlled by only the systemic blood pressure. And whenever there will be any alteration in the circulation of blood, they may lead to the, this is the autoregulation of cerebral blood flow may stop. And due to this stoppage of blood circulation, there may be serious complication like stroke. You can say if the blood pressure is hypotension if the blood pressure, systolic blood, and this cerebral blood flow, cerebral blood circulation is totally maintained by only systolic blood pressure, and cardiac phenomena is maintained by diastolic blood pressure. So if the person is having less than 17 mm of Hg blood, there may be syncopal attack due to the lack of blood circulation in the brain. And if hypertension more than 80, blood pressure more than 80 but 140 to 180, this is the one of the region where you have to be very cautious regarding this, because in this time person may have not any sign and symptom, or they have sign and symptom that depending upon their, I will discuss later on. I can recall one our PGT, I can say, and he is also from NIH, UG NIH, and he was always drowsy like drowsy. And one day he has came in our department, you are also Dr. Sumana is there, and told, sir, I am having numbness of one side of face. I told, why? Why numbness? I think this looks like a facial palsy symptoms. And you have examined, there was, as per etiological concern, there was no such viral concept, or there is no any history of viral infection. I told, this is that may be the cerebral cause, and I have told, I himself examined the blood pressure of that student, and the pressure was 180 by 110 like that. I told, why? This is in this age. The main thing, what point I would like to emphasize over here in front of these learned professionals, he told that, sir, আমার ফ্যামিলিতে আমার মা বাবা আমার সব হাইপারটেনসিভ আছে, আমাদের এই টেন্ডেন্সি আছে স্যার. This is the very common question and very common answer is coming in front of doctors who are the practicing either remote area or city area. I told, no. This is not a matter of family history, but your reading is high. And you have advised for the certain investigation, even CT scan, everything was normal. And consider the hypertension was the main cause, and he has taken medicine, and now totally facial weakness was okay, and he is cheerful. So this is the identification and diagnosis, the condition, and how they are leading. You can discuss later on in the clinical feature, but this is the measurement of the blood pressure. Actually, this lecture is for the UG classes also, but our duty to examine the pressure gradually, and you can examine either any several times patient or doctors or student are asking, sir, what is the suitable position to examine the blood pressure? So pressure can be recorded either in sitting position or lying down position, and there should be at least 3 reading within 1.5 hour, within 1 hour or half an hour, and average reading can be considered as a normal reading of this. This is the sphygmomanometer, and this method is generally, what method are using in clinical practice? Generally British and American association method, that is the used worldwide. Auscultative palpatory method, that is the more common method to recording the blood pressure, and that should be practiced over either in clinical practice, hospital, or anywhere, auscultopulpatory, because if directly some person are doing direct auscultatory method, that may lead to the certain complication. So first you palpate the pulse and then auscultate, and that is the considered as a most accurate and the normal reading of blood pressure. Classification generally primary and secondary. Primary and secondary. Almost 80 to 85% hypertension is primary, considering with primary etiology, and that is known as essential hypertension. Essential may be benign, that is the etiological and hereditary factor. Malignant is generally untreated case of the hypertension. Another is toxemia of pregnancy. This pressure is also comes under primary type of blood pressure, because all the considering factors, sign and symptom, there is no certain etiology is known regarding this. So toxemia of pregnancy is also considered as a essential hypertension. And up to 10 to 15% cases of hypertension is coming as a secondary, and this secondary hypertension generally occurring before the age of 30 years, and there may be several causes. Either you can say renal cause, if the person is having pressure is very high, either systolic, diastolic, or both is very high, there may be the renal cause is most commonly occur, either congenital or acquired. This is the renal cause. Endocrinological cause, there may be Cushing syndrome, pheochromocytoma, all this. Neurological, this cause I am not going this, but secondary cause, this is the metabolic, diabetes mellitus, chronic gout, and atherosclerosis. Atherosclerosis is the disease condition, clinical condition which occur generally due to arterial changes, and that depending upon the age and lifestyle situation of the person. One secondary hypertension is very concerned nowadays. Generally, this report, either newspaper, TV, or in general talks coming, that one person of this 35 year has died with the stroke or due to cardiac failure. This is nowadays developing death in even in Indian continent. Stroke is occurring under 40 years. This is the very rare phenomenon for European country. Or cardiovascular failure. Sudden one healthy person is coming news that today was okay, but tomorrow he is not there. Yesterday he is not expired due to cardiac failure. And the main lifestyle disorder nowadays, this clinical condition is hypercholesteremia. If the person is having irregular diet, irregular sleep, no their physical exercise, and bulky abdomen, and they are having knowingly and unknowingly, this is the condition of hypothyroidism, because hypothyroidism and the hypercholesteremia is the associated each other. If the obese person suddenly developing this hypothyroidism and hypercholesteremia due to irregular diet, there is certain, and this person is generally developing cardiac arrhythmia. Dr. Chattopadhyay sir is here, and he is cardiovascular expert. His book is also on this topic. I hope he will enlighten this. But the person who is having hypothyroidism, either diagnosed or undiagnosed, and they are having hypertension. This is the secondary cause, and sometime unnoticed, and suddenly they will develop the cardiac arrhythmia, and that will lead to the premature death. So this is the one of the very alarming secondary uh, lifestyle disorder, and that will developing, and this type of death is occurring in our society. So there should be very cautious regarding the blood pressure. I will discuss later in clinical features also. Homeopathic concept regarding this etiology, generally you are considering the etiological concept that make the individual susceptible regarding the disease, and thus predominating sign and symptom that is impregnated with our fundamental cause, that may be psoriasis, syphilis, psychosis, and this miasmatic impregmentation is always depending upon our present symptom, what type of person is having symptom, or what etiological factor is in behind the development of this present complaint is totally depending upon that. So along with knowledge of disease, our homeopathic concept should be at, correlated for the developing our new developing therapeutics concept in the field of clinical medicine. So this is the clinical feature. Generally, symptoms are variable. Hypertension, the main there is thing, the symptom is not fixed. At the same time, vague. This two terminology in clinical medicine is the very important for the study of hypertension. Variable symptom and vague symptom. Even vague, sometime person is uh, narrating symptom that is not, that symptom is having no such relation with hypertensive knowledge of disease. That's why even today our community health statistics said that more than 60% cases of hypertension diagnosed accidentally. Not only this one, even diabetes mellitus. One of the our moderator has narrated in his introductory speech. Diabetes mellitus, even in remote area, the person diagnosed accidentally. And this hypertension is the one of the so serious indicative disease, sensitive disease. That's why you professional should must emphasis to developing the skill or promoting the student. What you used to tell our student, please carry on this sphygmometer and please check at least, even in when you are the student. In our time, late Dr. S.C., the great respect and honor to him, sir, that without sphygmomanometer and stethoscope, he never allowed in clinical classes. Nowadays, very sorry to say, you are always emphasizing our student, but they are only giving emphasis over sign and symptom, and sometimes they are presenting the case. Have you checked the blood pressure? No, sir. Where is your pressure machine? Sir, Anini. Why? So this is our introspection and promotion of technical technology development or teaching. That is the main thing, because several times this disease remain undiagnosed and person is suffering because symptom is no fixed, and there is certain vague presentation. I will discuss later on. So that's why this condition is divided to better understand this three stages clinical feature. One person is having hypertension, but there is no symptom and sign, asymptomatic. And that case only diagnosed when you are examine the patient regularly. And there may be certain vague symptoms. Second stage, hypertensive diseases. This hypertensive diseases, a person is having psychogenic presentation. And this psychogenic presentation is not always supporting that this is the symptom of hypertension. As psychogenic or as vague that you are unable to correlate between this, whether this is the hypertensive. Sometime few days before, I have one day 3 patients, and all of having, after examination, all are having high blood pressure, more than 117 and more than 100. When you have told that your pressure is high, no sir, there is no any complaint. But if you have correlated, there was the psychogenic presentation, claustrophobia, irritability, no interest to usual work, insomnia, headachenes, but these symptoms remain, as you are saying, accessory symptom that remain unnoticed by patient, that they may be, sir, ये बिजनेस का टेंशन है ना, फैमिली में बहुत टेंशन चल रहा है, इसके चलते हो सकता है. But whenever you are examining the blood pressure is high. On that time, our duty to control or this guide the person whether to take either medicine or to control, because if there is any this persist this pressure, they may lead to the dangerous condition to the life. And another is hypertensive disease with complication, and this is the generally occurring due to involvement of the target organ. If pressure will not control, this is the main concern area for the physician, for the doctors or our professional. If you deny or you neglect this condition, clinical condition, they may lead to the effect to the target organ, that is the heart, brain and kidney and eyes. I can recall when I was in Mahesh Bhattacharya Homeopathic, Dr. Chattopadhyay was there. Dr. Chatterjee is easy to say. Dr. Chatterjee is here. There, one female patient I can remember from Ramtala, very near to the Mahesh Bhattacharya College. She is used to very, you can say, ardent follower of homeopathy, and she used to visit our OPD someday, and she has visited. One day I have noticed, she told that, sir, I have blur vision in one eye. A student had presented to me. I told, have you checked her pressure? There was no recording any blood pressure. And on that time, blood pressure has been checked. That pressure was around 200 by 120. I told Ma, pressure অনেক বেশি আছে. Either you have to control this blood pressure within 24 to, as per WHO guideline, this blood pressure must be controlled within 24 to 48 hours. So I told Ma, this is the very high blood pressure. আপনাকে আমরা ওষুধ দিচ্ছি, বাট যদি কোনো অসুবিধা হয় আপনি ডাক্তার দেখাবেন, না হলে সন্ধ্যাবেলার চোখে ডাক্তার. I refer to the eye specialist, and at evening she visited eye specialist, and eye specialist has examined the patient and she has developed the retinopathy, and his vision was around 90% lost of one eye. This is the condition, hypertensive retinopathy. This angiography has bring to next day in OPD. I have told that she was very ardent, but this is the thing, she has lost his vision of one eye around 90%. So if you neglect by knowingly or unknowingly, because you are always giving the either having knowledge of disease with due respect, or you are missing out this clinical condition, but this will lead to this severe complication. And this was the live case in my life in Mahesh Bhattacharya Homeopathy. So this is the clinical and complication. If you deny, there is main risk. There may be cerebral hemorrhage. What I have told, that there is relation between cardiovascular and neurology. Hypertensive encephalopathy, you have got some patient in when I was in Mahesh. So these are the complication, acute or chronic. You have to, if you not control the blood pressure at a time, this will lead, you can say this is the one of the serious stroke, visual loss. So these are the kidney, eye, this target organ will fail. And cardiac arrest, what I have told, generally occurring in the case of hypertension, if the person is having hypertension and hypothyroidism along with hyperlipidemia. So these are the conditions. Prognosis, generally in our homeopathic philosophy, anamnesis, but in clinical medicine, prognosis, either anamnesis or prognosis, that depending upon the underlying pathological condition of the disease. And this is the main thing what our moderator sir had told, etiopathogenesis. And this is the basic concept of developing the clinical features and the prognostic condition. You can decide and what degree of this changes clinical investigation or symptom are presenting, that totally depend upon the etiopathogenesis of disease condition. So prognosis not depending upon the name of disease only. अनेक समय just আপনার pressure আছে, that no problem, that will be okay. But what type, but অনেক সময় আমরা হোমিওপ্যাথি তে বলি রলফিয়া দিলাম, by one medicine you have given, then no, not working, this homeopathy is not working, you have to go like that. But I always emphasize underlying cause and pathogenesis, etiopathogenesis. What type of etiopathogenesis is there? Either functional, essential, or secondary, or what are the any chronic disease underlying that. So all the prognostic condition is depending upon the underlying etiopathogenesis of the disease condition. Laboratory investigation, generally no direct investigation for the hypertension only. There is still depending the underlying cause. Only investigation of the hypertension to please check the blood pressure. This is the even who guideline. You promote the checking of blood pressure because this is the missing. If the anyhow that and clinical in laboratory investigation depending upon again etiopathogenesis, what type of disease condition is there, on that basis this all this investigation, x-ray, ECG, echocardiograph, ultrasonography, all this depending upon that. So this was the disease condition, and this is the homeopathic treatment. Being the homeopathy, in the light of homeopathy, being the homeopathic practitioner, be the ardent follower of homeopathy, our main motto to developing this therapeutics and developing the conceptology and giving the benefit to the society and public health sector regarding this. You see, this is the repeated blood pressure measurement. And this measurement produced two conditions, hypertensive urgency or hypertensive emergency. Hypertensive urgency, this can be observed by only physicians who are the visiting, whether the pressure is at what level, this urgency whether you can control or not. And hypertensive emergency, that lead generally stroke or stroke-like condition or any cardiac arrhythmia, that should be maintained at intensive care unit. Nowadays, even new CBDC course in PGT, this preliminary knowledge of management of disease, they have to be trained like that. And if there is hypertensive urgency, whether there is need of pharmacological treatment or non-pharmacological treatment, because this is the also one of the concept nowadays, because these are the lifestyle disorder, and nowadays homeopathic individualization to personalized disease condition concept is growing up. So there is need of any pharmacological or non-pharmaco. This is the actually guideline which pressure should be treated, which should be observed, which should be this. I am not going detail, but risk factor, because this is the lifestyle modification disorder. Essential not modification, essential, because there is certain feature that is the essential that cannot be changed, like age, sex, genetic factor, ethnicity. And this is the non-modifiable factor. But certain lifestyle modification may control or may lead to the normal physiological activity of the patient person, and that lead the patient disease phenomena, delaying the disease phenomena for the certain year. And these are the modifiable factors, risk factor. These are obesity. You can say nowadays after 50, obesity itself is a disease. And if you go through the recent literature of clinical medicine, they are promoting after 50, you must promote the walking. Walking is the best exercise you have to learn. And the promote 2 to 3 kilometer, at least 3 to 5 kilometer daily walking, and reduction of the weight at least 5 to 10% of the body weight. That may also salt intake. This is also one of the major factor in hypertension. But sometimes patient is asking the question, person কি নুন একদম স্যার বন্ধ করে দেব, না কাঁচা নুন খাবো, না ফ্রাইড নুন খাবো? That is the question. But never stop the total salt, because they may lead another complication that should be reduced. At least 50% salt can be reduced in the diet. And alcohol consumption is the same question. Never stop totally consumption. The person, if they are habituated with this, and physical activity and other factor that leading to, like I have told, hyperlipidemia or hypothyroidism, like this. So these are the modifiable factor that can be modified and that control the blood pressure and hypertensive condition. In the therapeutics, generally being the homeopathic, you are treating the symptom syndrome of the patient along with individual character. You are considering and making the totality. Even I am one of the great follower, Dr. S.P. Desar. He has also told in his writing, etiological factor must be considered in our totality along with the symptom syndrome, whatever the disease. And nowadays in our college DNA, there is my colleague is Sumana is there. You are trying ICD-11 coding, and there is symptomatology, and you are trying to. This is the my thinking that you can consider the guideline symptom or keynote symptom of his disease, and you can totalize and you get certain group of drug along with the person individual symptom. You can develop one therapeutics that will be more closer to the therapeutics, like Dr. Boger has very beginning in his life has mentioned the affinity of drug toward the organ or toward the disease condition. So this concept you are treating certain drug. This is the not a suggestive. These drug are using you are using in our clinical practice day to day. Natramur generally salt is the one of the major etiological factor if the person is taking. Even in our stalwart books they have recommended this drug in high potency for the controlling of blood pressure. Rolfia can be considered as a general in physiological dose, and always this person is having hypertension with insomnia, and they can be controlled in the essential. They may be helpful for the controlling the essential hypertension if the person is having hypertension with insomnia, sleeplessness. Convallaria megalis, I have a memory with NIH with this drug. Dr. Pralay Sharma, Pralayda, now the director in charge, he was just senior to us, and he used to teach in our OPD. One day you have discussed this drug, and this drug can be used for the diastolic hypertension. And since that time I am also, and even I have talked with Dr. Pralay Sharma, he is also using, and this drug is very much useful for the diastolic hypertension. Even this hypertension, person is having systematic disease like diabetes mellitus, hypothyroidism, hyperthyroidism, and hypercholesteremia, and even they are taking modern medicine, modern science medicine for the hypertension, still the blood pressure is not less than 100 or 110. On that time, along with that medication, this convallaria in drop dose have worked wonderfully, and there is certain need of research like that. But I have got the result, and I am using in my day-to-day practice in OPD or even in general. So this is the one of the very good drug for the controlling diastolic hypertension. This is the Varitamur. This is also, there will be pulse pressure, arteriological factor, arteriosclerosis actually. So there will be high blood systolic and low diastolic, and this drug may be helpful. Aurum metallicum, Dr. Boric has recommended 30 potency, and generally for the patient who are having atherosclerosis, and this is also age related, and atherosclerosis is the one of the modifying factor of the disease, and that time this drug may be helpful. Another is uranium nitricum is also person is having so complication along with diabetes mellitus, nephropathy, and cardiovascular involvement. Along with this hypertension, person, this emaciation debility, the symptom of the disease, I think so. But this may be indicative for the selection of uranium nitricum. and you are using this drug with successful result. Lycopus virginicus, I am using this drug in the case of thyrotoxicosis, where systolic is very high, diastolic is very low. And this is the tendency to reduce the sudden cardiac palpitation and anxietic movement of the heart. This drug is also useful, and there is need of research in our PG. Dr. Chattopadhyay is here. He is even principal administrator is there. There is research work is required as individualized condition and individualized disease phenomena for the developing the therapeutic condition of the repertorial approach. There is certain repertory where this hypertension directly written, but I don't think this is the much benefited. If you consider the homeopathic philosophy, you always considering the totality symptom syndrome of disease along with the individual character. So that is the main feature. But this repertory book is also one of the indexing of the symptom of the disease phenomena. So you can take help and you can develop this. This is the nowadays this is the advanced teaching is going on, whether advanced teaching, whether research or the knowledge of clinical medicine. I am very doubtful regarding that. Research, this research work is going, and this is the general research, and you have shown the significant effectiveness of our drug. But there is personally, there is certain query regarding age. You are always considering age 18 to 65. If you go through this age, this disease, knowledge of disease, as Hahnemann has mentioned is very beginning in Approach 3, disease pathogenesis is always depending upon the age involvement, and that may differ. So there is one interpretation of any research is not sufficient. One complete interpretation is required, at least 10 to 15 research. This is not my word. This is the one of the great stalwart of the researcher. So only single research is having this Rolfi or Biscom album of any drug. That is, and these all researchers are our student. By luck, they are our student either Mahesh or in DN, they are in Calcutta Homeopathy, and this is the research condition of our homeopathy. So ultimately, hypertension is the one of the serious socio-economic, alarming, and more sensitive disease condition that must be recorded and must be reported and must be controlled at a time. Otherwise, they may lead to the disease condition like stroke. And that stroke, what I used to teach in neurology, if the person is died, that is relieved. But if he survive, he has to lead the complete life with complication and depend upon the other person. So please, please, please do develop the habit of examining the blood pressure in your routine clinic. That is the our this seminar today. Relax your mind, and thank you very much. And my extensive thanks to Dr. Arko Mukherjee, worthy son of Dr. Bidyut Mukherjee. Whenever I call him, he has assisted, has guided, and my again sensitive thanks to my daughter Meghna for this technical assistance. She is always with me and she has helped a lot. Again, my thank from the core of heart to this whole team of Alumni Association of NIH to continue, and especially to Dr. Bidyut Mukherjee to continuing this seminar. And I am requesting even in our college, Indian, the even principal of Calcutta Homeopathy, there is need of correlation between practitioner and institutional to developing our therapeutics mode and therapeutic skill to promote the homeopathic science to the worldwide and globally, because this is the second largest worldwide accepted pathy. So this is the great responsibility on our shoulder to continue this. Thank you very much to everyone. Thank you. Hello? हेलो सब चले गए हेलो ओवर टू डॉक्टर Chattopadhyay sir.
Hello. It was a nice presentation from Dr. Professor Dr. Mohan Giri. He nicely elaborated about it. It was refreshing and also some new things he already added. That is the hypertension in 20% to 30%, like endemic. He was telling like endemic, and for premature death, sudden premature death, this is the second commonest one of for premature death. It remained mostly asymptomatic. That is the essential hypertension. So this is the real scope of homeopathic remedies for the asymptomatic. Dr. Giri also told about emphasized on routine examination of BP. That is the now ICMR also emphasized on the home monitoring system of blood pressure. And Dr. Giri just in the very first phase, he emphasized on persistent rise of basal blood pressure, 150 by 90. It is very persistent. The word, it is a very common thing that we have to give emphasis on this persistent rise of BP. We must, and males are more prone than female. He also mentioned that maybe due to stress or males are more smokers, but also we have to take care of that females having the more estrogen. The estrogen has got its role on protective cardiovascular diseases. That may be also one of the point from, but all those are right now, it is of not so important value like when we were student. Nowadays, the epidemiological research, observational research are telling something more than that. And auto-regulation of cerebral blood in the mechanism of hypertension, especially essential hypertension and the established hypertension. This auto-regulation is a very important from physiological point of view. Measurement of blood pressure is also very important, because in most of the cases we have seen that the measurement is not the right one. It is not very easy to measure blood pressure, because there are certain steps. We have to know all the steps very regularly. We have to know how to palpate the pulse, how to see the blood pressure, the measurement of BP, because on the basis of these measurement, one policymakers or one doctors or whoever, they have to decide the medicine, homeopathy, modern medicine, or Ayurveda, whatever medicine may be taken. If the measurement is wrong, even in persistent 3 consecutive measurement is wrong, then he or she should start taking medicine. So measurement of BP is very important. The methods, nicely he in his slides, he showed everything, even the flash method of children. And which is most important, that is 80 to 85% essential hypertension, under which he also said, Dr. Giri was telling about toxemias of pregnancy. That was, we told that gestational hypertension, no medicine may be required. With the time, it may come. So if medicine may be required in very few cases, but we should know that gestational diabetes or gestational hypertension, it may come down with the time. So whether medicine is required or not, that we have to judge at that time. And secondary cause, the very important one, and mostly nicely, very, for the very little time he told, but it's very important word that secondary causes mostly found in the young age, mostly in the young age. So renal causes, under renal causes, acute glomerulonephritis, chronic glomerulonephritis, pyelonephritis. Even nowadays, autoimmune disorders, amyloidosis, all those are the under renal causes, endocrinal causes, thyrotoxicosis, Cushing syndrome, under metabolic diabetes mellitus, even chronic gout and diabetes mellitus are very important from metabolic point of view. Under miscellaneous SLE, systemic lupus erythematosus, and psychogenic cause is also very important. And he was telling about stroke under 40 years. Nowadays, it is becoming very common. There are so many debate is going on that whether it is due to vaccine or whether it is due to COVID virus effect, or it is environmental due to stress also. So debate is going on. But stroke under 40 years, it is right now, it is a challenge to the medical profession since last 1 year at least. And what Dr. Giri was also telling related to hypothyroid diabetes mellitus, I must say that since last 7 to 8 years, if I am not wrong, there is separate chapter or separate paragraph in the clinical medicine books which is emphasizing on the coexisting of hypertension, diabetes mellitus, dyslipidemia, and hypothyroidism. So one thing we must know that in the diabetes mellitus, the main basic pathology is the microvessels. And so epithelial cells damage, the lining damage, the basic diabetes mellitus, like hypertension, is also very silent killer. So we have to, the lifestyle modification, not only that you have to take medicine from the very beginning. If you require, you must take medicine, whether it is homeopathic or modern medicine, but lifestyle modification and stress less life as much as possible. It is not possible, very easy to say that your stress should be nil. Everyone has stress, depending on their lifestyle, depending on their environment. But at least if we are very much conscious about this, that lifestyle modification, then these diabetes mellitus or essential hypertension, type 2 diabetes mellitus, even up to a certain stage, it may come to normal without any medicine. I am not talking like that you should not take medicine. Medicine is very much essential. Measurement is very much essential. Very early screening is very much essential. But with that, very early lifestyle modification initiation is also very important. It is very 2 point. I must mention that white coat hypertension, which we know that in any clinical setup to doctors, the blood pressure become high. Whenever he return to home, it becomes normal. Just opposite is mast hypertension. So there a good amount of consultation, like our homeopathic good case taking, this counseling is a very important one. Updated right now. One thing that is updated blood pressure target. There are 3 guidelines. One from American guidelines, American AHA or ACC. Their guidelines, their targeted BP is 130/80. European guidelines, their guidelines 140/90. And International Society Heart Hypertension, their targets 140/90. So they are little bit liberal, like European and International Society, 140/90 they are telling. But American ACC, American Cardiology Society or American Heart Association, they are telling 130/90. Even if you go through the latest direction of WHO, 120 to 129, whenever we are crossing 129, you can be stamped as hypertensive. If the concept of pre-hypertension right now is in crisis. Whenever the stage, the new classification from 2024-25, it come, now the concept of pre-diabetes and pre-hypertension is in crisis. Even it may not be there. So because very stage 1, the early stage, it is challenging the concept of pre-hypertension and pre-blood pressure. We should remain updated with this. So because one patient having no hypertension because he was 140, and as per modern medicine book, he was non-hypertensive, but suddenly with one direction, he came to know that he is hypertensive because he has crossed 129 and he has to take medicine. Whether that medicine is required or not, the time will tell, the clinician will judge. So very nicely, Dr. Mohan said that it is not only homeopath that we are talking about individualized. Now the individual management, personalized management, it is not only personalized medicine. The individual policy management is right now, it is the recent clinical trends in clinical medicine. So one patient, the doctor will think of that patient having hypertension or having only single hypertension or coexist with DM, hypothyroid. So what type of medicine he will take, what type of exercise will be advised, what type of diet he will be take. It is not the generalized concept that all hypertensive patient will take this, all diabetic mellitus patient will take this. They have to, right now they are giving importance on the individual based management, personalized management. It is in the crude sense following our homeopathic principle. So this is the concept of clinical medicine, individual target therapy, individual precision medicine. We right now it is telling even what are the causes may come. Dr. Giri rightly was telling about Barita-Muir. Barita-Muir usually is of arteriosclerosis and usually of old age. Arteriosclerosis, we all know, with the old age, arteriosclerosis is very common. Auscultatory gap is there during measurement of BP, which is more or less physiological in the age-old person due to arteriosclerosis. Up to which stage of arteriosclerosis with the age is the normal at that perspective, that we have to know. Whenever the patient having age 80 plus with a severe form of arteriosclerosis and the patient is hypertensive, he may not be hypertensive in his age perspective and a pathology of arteriosclerosis perspective may not be, that is normal to that patient. That understanding we should have. There is nothing emergency in all cases, but in silent cases there may be also emergency. So only a right clinician with updated knowledge can face the challenges. This is the very important. And time restricted eating, with it is the latest one findings came out that the time restricted eating and intermittent fasting show promise in BP reduction. One. And ICMR is giving importance on salt intake because of the challenge. Indians, they are taking high salt intake, 9 to 11 gram per day. This is the challenge to ICMR. DASH diet, you all know that DASH diet we have to advise by the ICMR, home BP monitoring. And persistent hypertension, it is one thing that is the modern medicine or now the society clinical medicine is now, it is very important one that the blood pressure having 140 by 90, more than 140 and 90, and patient has been taking three antihypertensive drugs, even with diuretic, but hypertension is not controlled. This is called persistent hypertension. Whenever we have to depend on very many things, integrated therapy, pranayam, yoga, homeopathic remedies, exercise, lifestyle modification, stress reducing part along with modern medicine. So this persistent resistant hypertension is one of the challenges to clinical medicine. And Dr. Mohan in the therapeutics part told about convoluted images. I was just remembering the that convoluted images. It is the part. It looks like heart. Is the doctrine of signature, like that. Convoluted images is a very important drug. Anyone want to read it? It is a very authentic book from old forgotten remedies of E. Ansu's. Convoluted images is very majorless, very important drug. We can think for Lycopus virginalis, systolic pressure very high, diastolic pressure very low, like Orammet. Orammet, usually it is written in 30 potency, more or less specific, written in the boric. But as my observation, I have seen that Orammet hypertension is usually of young age and may be related to renal disorders. So renal secondary hypertension may be the Orammet, but I think from homeopathic perspective, we have to give more importance on essential hypertension because during our time it was told idiopathic. Now it is not told idiopathic, but still the very exact cause and effect relationship cannot be established in these established essential hypertension cases. So we have immense scope on this. and with lifestyle modifications, good homeopathic constitutional treatment. As per, if anyone can ask me that which drug you have got result much more, I have nothing, because I always prefer constitutional remedies, and experimentally also in hospitals, in OPDs, in IPDs, we have given the drug also in very gross pathological damage cases, the mother tinctures. But I can say, if it is from my personal opinion, that a hyper Raoulfier mother tincture or anything in the form of mother tincture, then any good constitutional effect, even the patient having left ventricular failure with rattling chest and with clean tongue, we have got very good result in Ipecac 6, like of us in the cardiac failure, heart failure state. So heart failure state is a part of our unintelligent vital force to make us live. So in that heart failure stage, especially of right heart failure stage, we can get ample time to select the medicines. This is not the emergency state. In the heart failure state, also the modern medicine, they use their treatment as conservative treatment. So we may have to go through conservative treatment. In very many cases, integrative approach is also very helpful. But it is not that homeopathic medicine is not at all effective. Even aconite, arnica, these are the very small remedies we think, but these are the very, very effective with the numbness of, specifically of aconite related with mental domain. The miasmatic trait we can think of, we know the very basic things of functional of sora, syphilis, and syphilis destructiveness, psychosis. We know the pseudosora of our J.H. Allen, the pseudosora concept of J.H. Allen with the essential hypertension. And whenever it is a secondary cause or any arteriosclerosis like or any deposition like in the membranoproliferative glomerulonephritis, when there is crescent in the immune complex is there, so we can think of predominant psychotic. So the predominant miasmatic concept can lead us to think of a group of remedies. From that group of remedies, we have to again selective in the individualistic part. But in very many cases, the patient may give you no time. At that time, very selective. Some remedies are of very good help, like to increase the ejaculatory fraction. Strophanthus is a very, very effective drug. Even I must say that it may work more. It is not very much clinically proven, but I got result maximum from these, even more than Crataegus, Arjuna and Strophanthus both. So there are hypertension, essential hypertension we have to manage holistically. It is not the word from homeopathic philosophy, it is the word of clinical medicine. So because the direct cause and effect relationship cannot be established. This is our mere scope, and I have gone through, as Dr. Giri was talking about research. So I found 3 researches in the latest books of Ministry of Ayush. There is one published in homeopathy and one published in Journal of High Dilution, and third published on the Journal of Alternative Medicines. 3 all peer-reviewed journals, publications, and in one that is Viscum album. 10 drops given for 12 weeks, 12 weeks, 3 times a day, and significant p-value importance they got in the research. It was of 2014. And another research is by Detramur, Causticum, Lycopodium, 4 or 5 constitutional drugs they got. It is already, if you search, you can get it in the Google, already established this. So out of all this research work, there may be much more, but I have not remained updated up to 2025, but up to 2020-21, 4 or 5 exclusively result with a high peer-reviewed journal with good citation. I can found 3 or 4 only good research articles. Lot of research can be done. What we can do, what we cannot do. I can remember Dr. Rajan Shankaran's, not Rajan Shankaran's father, the P. Shankaran's one talk that I never, in which cases I see scope. In that case, that case may be my limitation. And in all those cases, I see limitations. In all those cases, I found that the medicine is working. So in which cases the scope is there and which cases limitations is there, you cannot fix anything. It is depending on the patient. It is depending on the stage of the disease. It is depending on the accessory circumstances. Right now, it is depending on the epigenetics. So we have to consider these epigenetics, the PRS scoring, the polygenic risk scoring, PRS. So from the miasmatic trait to polygenic risk scoring, from the accessory circumstances to today's epigenetics, from the individuality concept to today's personalized medicine, from the susceptibility to the tendencies, hypersensitivity. So the same things in the presentable now in the world of science. And if we go accordingly, we can think very judiciously, very rational manner that what are the causes behind this sickness without concentrating only on hypertension. Then I cannot say cure, but manage can be possible by homeopathic remedies from holistic point of view. But measurement, early screening, during diagnosis, all homeopaths, we should be a clinician. But during making our choice of remedies, individualized homeopathic concept, we have to forget all those things. But in very many cases, you cannot get constitutional clues. In all those cases, we have to depend on pathological symptoms. We have to depend on the common symptoms with the help of repertory. So, and obviously in very many stages, mother tinctures also helpful, in very low potency also helpful. But in so many cases also, there may be very good use of constitutional high potency also. Thank you. Thank you again of Dr. Bidyut Mukherjee and his team for continuing this type of academic works. I must convey my also gratitude to speakers, learned wonderfully. He told everything about Dr. Giri and the inaugurator, Dr. Sumana. She was also a brilliant student. I still remember. So my and all others, seniors are here. Whoever has any question, please put it there. We can give reply through mail or in person. Thank you.
There is a question from Dr. Ujjwal Mundol. Give some light on PAH. For Dr. Mohan, and the question is on the screen now. The question is, give some light on PAH.
Hello, actually. Hello?
We can hear you. We can hear you.
Dr. Rajat Chatterjee, sir, you can explain it first.
Hello. Hello.
Over to you.
First of all, I must say, I must say, first of all, that PAH is not curable. PAH cannot be curable. It is totally incurable disease. It can be only managed. So whatever the basic pathology behind the PAH, if we go through the PAH, that is the fibrosis like that. This is a purely, predominantly psychotic conditions in which the pathology, we know the two things, that is the reversible and irreversible. Usually, like scleroderma or anything other like these, PH also in the chronic hypertension, it goes to certain such stage that the reversible condition may not appear. Your homeopathic does very less work done on this case, and whenever a patient with severe PUH having very constant of shortness of breath come, usually it goes to ICCU, and even the very high, more than ICCU in a very emergency stage, and homeopaths got very little opportunity. to treat this type of. Only symptomatic management can be done. Also in clinical medicine, it is written clinically management can be done. No cure we can think. If anyone claim that he is cured, then he may publish his paper in any medicine. Till date, I have not got such a paper. If the question who questioned this, definitely he has gone through his experiences. If he gets this type of cure or this type of application of homeopathic medicines, then he may enlighten us because I have no such experiences.
Professor Rajat, there is some network issues. There are some network issues. Any other question from Facebook page? Orko, any other questions from Facebook page? I cannot generate from the Facebook. Thank you, Dr. Ujjwal Mundan. Very good analysis by Dr. Chatterjee. That's a compliment. I'll request our beloved Dr. Narayan Kalyani, sir, to give his vote of thanks and his views.
I also want to say one thing, Dr. Bidyut, Dr. Mukherjee, Dr. Kolkata. No, I have not never mentioned name of Dr. Kolkata, without which this Dr. Bidyut Mukherjee and Dr. Kolkata, this is a unique combination. I must convey my heartfelt gratitude to Dr. Kolkata also. Thank you, sir.
Thank you, Professor Rajat. Over to you, Kalyani, sir.
Thank you, Bidyut. Our most able general secretary. Many thanks to Professor Rajat. Fantastic one. I should say today's seminar will be memorable. We have learned many things. Not possible for any of the clinicians or even teachers to go through regarding this hypertension covering every point. And Chattopadhyay has given his personal experiences, covered all areas, and he has tried to challenge the modern system of medicine or conventional system medicine that they are proceeding for treating the India. Many thanks. Special thanks for his joining in the CME. We have been encouraged. This is a joint venture by all of us. All of us are inspired, encouraged by us. Fantastic progress we are experiencing, and we are expecting your participation, presence, and study. Many thanks to our speaker, Giri. Fantastic presentation, covering every here, every corner. He has given many information, which is for practical. Many thanks to our inaugurator, Dr. Sumana Sengupta. Fantastic inauguration. Today's seminar was brilliant, and as I am telling, that it is such a case, hypertension is such a disease, that it has been called as hypertension. I don't dare to speak anything regarding medicine before this brilliant, gigantic pillars of medicine in homeopathy, especially today's stage. Dr. Chattopadhyay, Dr. Giri, and Dr. Sindhu. Simply, I want to say to my brothers and sisters that the term hypertension is not only a disease, but also really a hypertension. Tension of the heart, tension of the brain, and other systems, kidney, or other important vital organs to get patient processing. Tension patient, whether he will die or survive. Tension of the family, and serious tension of the doctor, because at any cost, doctor must try to make the patient alive, safe from the accident of the life. That is why many years before, the term has been given hypertension for all. As Dr. Giri was telling, rather interesting information that today's students, they are not carrying stethoscope and blood pressure machines along with them in Calcutta. It's very dangerous because the more you practice, the more you become expert. Nowadays, what we see, if you go in the advanced hospital, modern hospital, you will see the moment you are entering, before going to the doctor, before taking complaint before the doctor, sisters will check your blood pressure, your height and weight, to assess the BMI and control the blood pressure risk. Not only blood pressure is concerned, but blood pressure is connected to the heart, therapeutic system, and many other conditions, autism, consultation, etc. So first that is checked by some attendant or nursing staff or attendant, then patient will go to the doctor. Because of the reason, it is really hypertension. Matter of tension that should really fall. Well, maybe the case. I consider that all the alumni of NIH are consultant practitioners. So as Dr. Giri was saying, that we should never forget to see the blood pressure. Otherwise, we are inviting many bad information and missing many good information. Let me tell you, if we do not check the blood pressure to the patient, especially above 30 years of age, whatever may be the complaint, before doing the complaint, first of thing, if we do not check, we are missing to get the name and name of careful doctor, serious doctor. Doctor is looking through and through. Before going to him, he is checking blood pressure, weight, height. That means doctor is over caring the patient maximum care. That is one benefit for the clinician. Number two, doctors are getting chance to experiment how far homeopathy can work. Not only patients suffer from hypertension, but accidentally if we find a patient suffering from hypertension has come for the treatment of stable, so affects of some other disease, we will get another case of hypertension to experiment how far our considerable work can do. Next is hypertension is checked. Patient can, doctor can save his life. The moment the pressure is above normal, immediately patient takes a step to first to save the life. We have seen in the emergency department anywhere, any moment we enter, first doctor will see the blood pressure because how hot is your pressure. Next they will see respiration, how oxygen is being passed. Then they will look after other system, neurology, nephrology, etc. So first attention is on heart. For this reason, that many patients can be saved by this simple checkup before doing the complaint. CME, incidentally, if we find that patient had COVID or was vaccinated, then suddenly pressure was found as very high. So immediately we can say, by our own, we can refer the case to consult areas for his life. Next is, we can avoid penalties, court cases. All of you might be knowing that consumer protection has gradually become very tightened for homeopathy also. If the patient is found that after visiting your chamber, having the prescription with date and signature, died of the hypertension or had paralysis or any heart disease, he had blood pressure, the doctor at any moment may be charged of negligence of responsibility. And that charge is not 100 rupees, 1000 rupees. Huge amount may be charged according to the patient. So from this regard, we can save ourselves. Then we are going to in here, we have tested the blood pressure, then we started. These are the privileges if we see the blood pressure, and if we do not see the blood pressure, so we should never forget to see the blood pressure. Next, regarding treatment, everything research has been discussed by two of our three professors. But I want to tell him that in my life, I have never seen a single patient by giving constitutional treatment. The hypertension has gone to what extent? Gradually increasing. Other complaints are reducing, patient is improving, but blood pressure is rising up and up. Had to go to somewhere. Rather, I have seen many cases that once you start consulting as a friend, symptomatic individuals with treatment. Before unknowingly, you will see blood pressure gradually coming down. Now, bringing blood pressure down is not a matter of joke, means not an easy matter. We cannot expect within 2 days. If the case is very chronic, we have to wait proportionately. What we'll see, what I have observed, is if it is the right drug, after experimentation evaluation and confirmation by the meeting department. give the drug and what observe by open eyes and observing blood pressure. That's what my medicine is working. When the complaint patient is experienced or the complaint patient has come to me, class the blood pressure, whether he is taking antihypertensive drug or not, you will see that first blood pressure is stable. There is no further addition of the conventional conservative treatment were required. Then there will be fluctuations, sometimes high, sometimes low, sometimes high, sometimes low. Then you will observe that gradually this low pressure tendency of lower is sustained for too long, it is pretty long time. Aggravation is becoming short period. And ultimately I have seen many patients that come down normal. It's normal. To that extent I am telling, conventional system doctor, heart pressure, they are not believing that pressure has come down to below normal. He is telling, you continue the drug, any government action that. Please do not stop conventional conservative treatment of your own. That will be inviting another risk. Ask the patient to consult the doctor. That cardiologist they will reduce the clinical condition. You go on saying the report that pressure is coming down gradually. Sustained pressure has become low and normal. Lipid profile is normal. Other complication was no reduced. Automatically they will reduce the drug. If patient forcefully requests us that I want to stop immediately as medication, I only on your pure homeopathy. I've been tired of taking alcohol. Then, as Dr. Chattopadhyay and Dr. Giri was saying, there are a number of drugs in what produce mother danger. We can supplement the conventional conservative treatment by observation, careful observation. That at any cost pressure must be Howrah. A constitutional drug is working. In addition, it was given by the modern medicine, few drugs. It's not only so we can try by our drug to keep it in normal state. And accordingly, very slowly, after withdrawal of the conventional system, gradually our drug is withdrawn simply on constitutional drug. There is no medicine in other system of medicine who can reduce arthritis. But medicine of the hypertension is simply conservative, management therapy. But our treatment is never management. It starts from cause of the arteriosclerosis, flow from the liver, metabolism. Then gradually, knowingly or unknowingly, from the very root, patient will start improving his complaint. Primarily, within a very short time, we may not find the improvement, but in long course of time, if you go on observing by investigation and careful vision, then we find that gradually, patient is becoming normal. So, in homeopathy, definitely we have scope. Plus, as Professor Chattopadhyay was telling, conventional system medicine nowadays gradually enlarging or gradually going towards individualistic approach. Homeopathy, from very beginning, we are on that approach, individualistic approach. Person varies, cause varies, reason varies. Naturally, medicine will vary. Our totality will vary, individualistic approach will vary. This variability is the main guideline of homeopathy system. Homeopathy never believes that this mother tincture short medicine will completely cure. There will be supporting drugs, but ultimately cure will be by the constitutional individualistic medicine, as Dr. Chattopadhyay was telling. One more I want to tell you what I have learned from my teachers, that for hypertension patient, because patient is tensed physically, mentally, and sociologically for the reason of hypertension, he should be advised to take relaxation for at least 1 to 1.5 hours, preferably 2 hours, and get relaxed by listening music, by seeing movies, whatever he likes, by gardening, by any other hobbies. So relaxation is a very They are the best medicine for hypertension. Plus, day rest after lunch. It is said that rest after lunch, rest a while. After dinner, walk a mile. So after lunch, hypertension patient must be advised to take a rest in a relaxed position, preferably as people lie on easy chair. By relaxing in chairs or bed wherever it is possible, that usually reduces tension, and patient will be advised that relaxation should not continue at least for half an hour. Completely relax, lie down or semi lie down, close your eyes and relax. Don't think anything. My advice to all the patients of hypertension is this: that try to take this rest at least for 30 minutes to 1 hour after lunch, plus relaxation. Plus, the management advice we have listened that modernization should be avoided regarding diet management, etc. No best we can control. Blood pressure treatment is in homeopathy. It is very easy. We can treat blood pressure along with other diseases. But for conventional system medicine, patients have to take different medicine for different conditions. For blood pressure, one medicine. For lipid profile, dyslipidemia, another medicine. For ischemic heart disease, another medicine. For anticoagulant, another medicine. So patient will be jumbled by medicine. For us, it is not at all. Simply as, for example, if we think of aura metallica, that drug itself will work on every organ, every system, plus this origin of the disease. So obviously, the diseases whose etiology is idiopathic, not very fixed, homeopathy is best for this type of diseases. Likewise, hypertension has, homeopathy has tremendous scope on hypertension. You can try. And I'm telling you that all of you, please check the blood pressure for experiment, that how far we can reduce blood pressure, plus to save the life, plus for your records that I can cure hypertension, plus our own also, our family members, we can make them alert by checking blood pressure. And as Dr. Giri was telling, that whenever you are in the doubt, get the test, means examine the blood pressure either sphygmomanometer or by any machine 3 times at least to make it confirm. If you find the reading is suspected, suspicious reading, age, complaints, body structure is not corroborating with the blood pressure, then get it checked at least for 3 times in a day. Moreover, ask the patient when you are taking the responsibility of treat hypertension with other diseases, ask the patient to get the test, to get the blood pressure checked whenever you feel unfresh. Not feeling well, check the blood pressure. Regular checking is not that much helpful, as it is helpful whenever you are feeling unfit or sick. Get it checked. That will save the life, that will help us. And note it down, inform me the next time. So obviously, we can make a program, not in an institution because we are scatteredly practicing in different places in hospitals and private clinic. Let all of us try on blood pressure, how for homeopathy can do. Jumble it, forward to us. We have our journals, e-journals, we have our CMEs, our different journals all over India. Try to publish even 2-3 cases if you find successful. Let others know that your treatment has been successful. That will encourage all of us. What usually we do not. What we do, if we want to get cure, we keep it within ourselves. Whatever improvement we got, please circulate to make others trendy that yes, we can cure. If we do that, in a very short time, we will see few hundreds of cases report will come with documents that homeopathy can give definite result on hypertension, whatever may be the cause, arteriosclerosis or kidney disease or whatever may be. One more thing, what I want to tell you, I have one experience during my student life. Dr. P.C. Pal, Calcutta Homeopathic College, that I remember the incident because Dr. Chattopadhyay is here from Calcutta Homeopathic College. So severe pyelonephritis. Pus is coming out instead of urine, blood and pus. As if urine is coming from the boil. Very high rise of temperature for a few weeks, 103-4 degree. And the patient were very much adamant to treat homeopathy for certain reasons that I will see how far homeopathy can do. Ultimately, he had to be hospitalized. Tropical School of Medicine was scheduled, but he refused, the patient refused that I will treat homeopathy. He was admitted under Dr. S.K. Dubey. At that time, Dr. Dubey was very famous clinician in Calcutta with Medical College. He was admitted in Dr. S.K. Dubey. But fortunately, early morning, Dr. P. Sivar, early morning means at about 9, Dr. P. Sivar suddenly came. There was one student cabin in Calcutta Medical College. I do not know whether it is still there or not. There's usually one bed, comfortable room, small room. Dr. P. Sivar suddenly came forward. You are here? What has happened? Then patient started crying that I am suffering from this type of temperature, tremendous burning, pus and blood is coming out. And Dr. S. Moitur was one surgeon in Calcutta Medical College. He advised RMO doctor, his name was Dr. Rothin Roy. Rothin, why you have admitted this case? His student immediately referred the case to NRS because his condition is very fatal, blood pressure is high. Immediately, renal transplantation is essential, otherwise patient will die. Rothin Roy immediately RMO, immediately ran to Dr. P.C. Pal. Dr. P.C. Pal told, I will give him death certificate tomorrow. Nobody should touch the patient. Make one board and hang before the bed of the patient. He'll be astonished with a very short time that student completely cured. After getting cured one day, when he was entering the hospital, politely asked, Sir, I have studied that pyelonephritis in serious condition, if destroys kidney tissue, that ultimately leads to hypertension. His reply was, immediate on standing, if this patient ever experience hypertension, he will tell me. On that moment, I will leave homeopathy. So this was the confidence of our teachers. That means not only hypertension can be cured, hypertension can be arrested. Whatever condition, whatever may be the diseases which leads to hypertension can be definitely arrested by homeopathic treatment, because homeopathic treatment from the root, not simply cutting branches, from the basic cause, from the fundamental cause. That's why whatever disease can lead to hypertension, boldly face it. Tell the patient that if you get cured, write it down, will never suffer from hypertension. This type of confidence we should have by simply experiences. So please try yourself on hypertension. Number of cases you will get every day and see the result. Thank you very much. Many, many thanks for enjoying and participating in this brilliant CME, memorable CME. Thank you very much. Thank you to all. Bidyut, please.
Thank you, sir, and thanks to all our eminent dignitaries who are present in today's CME. Professor Rajat Chattopadhyay, he has been my batchmate. I'm proud to have him as my batchmate. Our beloved Professor Mohan Giri, our beloved junior Dr. Sumana, and all the team. It's a teamwork of CME, of NIH alumni. There are a lot of people who are working behind the screen. We can see here few people, but there are a lot of people who are going day in, day out, like Dr. Chandrasekhar Kore, Dr. Rajat Pal, Dr. Ashok Rai, and many more, Dr. Ujjwal Mondal. So we like to thank everybody, and there is an important announcement for all the alumni across the globe. Our beloved director had permitted to uh, host the NIH alumni meet, on 12th of December 2025, and we'll be having regular Zoom meetings. Tomorrow there will be another Zoom meeting, not on YouTube, only for the alumni. The link will be shared had already been shared in the WhatsApp group. So please be there. And our we are nostalgic about the boys' hostel building of NIH, especially from first UG to almost 22nd or 25th UG. After that, that boys' hostel has been demolished. There will be new. There has been a new boys' hostel erected in that place, and that new building will be inaugurated in NIH this coming Wednesday by our respected Minister of State, Independent Charge of Ayush, on Wednesday 16th from 8:30 a.m. So the alumnus who can make them their time, please be there to show your solidity for your mother institution. It's before your institute, other means college time or office or clinic times. If you can come over there for a few minutes also, that will be a great thing. And please let us make this Alumni Meet 2025 a grand success. Our next CME will be on 27th, where we'll have clinical experience sharing by one of our eminent alumnus. Over to with this and with our permission from our beloved president, Dr. Narayan Kalyani. There has been a question from Professor Rajat Pal. What medicine did Dr. P.C. Pal prescribe for Dr. Kalyani, sir? A question for Dr. Kalyani, sir.
Sarsaparilla 6, only one dose. And that boy was Dr. D. Collectoris.
This is what we get from our CME. These clinical inputs, Rajat will agree, Mohan, Sumana, all of us will agree, will not get in a big seminar hall CME. But these are the essential inputs we get in this online CMEs. And with this, we thank all of us here and returning to Dr. Orko Mukherjee, our backstage editor.
Thank you all. Thank you. Good night.
Thank you. Thank you, sir. Sir, excellent speech and excellent add-on by all of you. Thank you to be here. Good night, sir.
It's a group work, teamwork.
Yeah.
Let us proceed.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like, share it with your fellow mates, and subscribe for more contents like this. And also press the bell icon, all notification, to get updates as soon as we schedule. And also, if you want to get update on WhatsApp, just join our WhatsApp link, means channel link. Go over there. We give daily updates, not daily, but we give updates about our future CME and about updates with all the alumni organization. So again, thanks for watching, and we are trying our best to get the auto e-generated participation certificate going on, so that we will give a provide to everyone currently watching here on live. So again, once more, thank you all. See you on our next CME. Until then, it's me, Orko Mukherjee.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.